Hello and welcome to Medical Dialogues. I'm Anshika Mishra. Let's look at today's top medical news. Doctor shows no sign of cancer after a year following Worldfirst treatment. Australian doctor Professor Richard Scolyer, who underwent a groundbreaking treatment for glioblastoma 1 year ago, continues to remain free of cancer. Despite being diagnosed with an aggressive subtype of glioblastoma, which typically results in survival of less than a year for most patients, Professor Scolyer recently shared that his latest MRI scan revealed no recurrence of the tumor. Glioblastoma is a type of brain cancer that develops from glial cells, which are supportive cells in the brain. It is the most aggressive and malignant form of glioma, accounting for about 60 to 70% of all gliomas. Glioblastomas can occur in any part of the brain, but are most common in the cerebral hemisphere of the brain. These tumors are highly infiltrative, meaning they invade and spread into nearby brain tissue, making complete surgical removal difficult. Alongside his colleague, renowned medical oncologist Professor Georgia Long, Professor Scolyer was named Australian of the Year for his research on melanoma, which is now informing his own experimental therapy. Over the past decade, the pair's research on immunotherapy, which uses the body's immune system to attack cancer cells, has dramatically improved outcomes for advanced melanoma patients globally. Half are now essentially cured, up from less than 10%.
Are you also aspiring to excel in medical journalism and delve into the intricacies of health and medical reporting? Explore our comprehensive course on medical and health journalism available at the Medical Dialogues Academy. Learn from industry experts who possesses in-depth knowledge and experience in this field. For further details, scan the QR code provided or access the link in the description box below.
Professor Long and her team discovered that immunotherapy works better when a combination of drugs are used and when they are administered before any surgery to remove a tumor. Last year, Professor Scolyer became the first brain cancer patient to ever have combination pre-surgery immunotherapy. He's also the first to be administered a vaccine personalized to his tumor's characteristics, which boosts the cancer detecting powers of the drugs. Dr. Scolyer's story is exciting because it draws attention to how game-changing it would be for so many condemned patients if this novel approach to the treatment of his glioblastoma did result in cure, said Professor Garg, chair of a scientific and medical advisory board. People vary in their response to treatments. Indeed, very few people with glioblastoma, perhaps 2 to 5%, may live up to 5 years, but most succumb earlier, particularly if they are older and the tumors are larger. In many cases, we can say that age, extent of tumor and surgery, and other individual factors will all modify how the tumor behaves. Thus, a person with a small glioblastoma who has had good surgery and chemo and radiotherapy and is young will have a good chance of surviving 18 months. One would need to see such a person surviving well at 2 years or more to start to consider whether this heralds a breakthrough. This new treatment is novel and interesting and applied in the kind of innovative way that we need to see researchers trying. So we all hope that this offers the key to a better future for brain tumor sufferers. Thank you for watching. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.